Trials for another COVID-19 vaccine have started in South Africa. The Novavax clinical trial will be led by Wits University Professor Shabir Madhi. Studies of the Novavax vaccine conducted in non-human primates showed protection against SARS-CoV-2 infection in the nasal passages and lung disease. According to Professor Shabir Madhi, conducting such trials will help the country generate evidence on how well these vaccines work in an African context. The South African trial will be undertaken on 2,900 volunteers. The aim of the trial is to evaluate a particle in the vaccine that protects against the coronavirus in adults aged between 18 and 64. The nanoparticle S protein known as MVX-CoV2373 is produced by biotech company Novavax in the United States. So, as we mentioned, Wits University today beginning screening participants for that second COVID-19 vaccine trial. The phase 2 trial in South Africa will evaluate, as mentioned, the nanoparticle S protein, which protects against the coronavirus in adults aged 18 to 64 years old. Meanwhile, the Africa Center for Disease Control and Prevention has reported that the number of coronavirus cases in Africa has surpassed the 1.1 million mark, with over half of those cases attributed to South Africa. We're joined now by the World Health Organization's Africa Regional Director, Dr. Matshidiso Moeti. A very good evening to you, Dr. Moeti, and thank you so much for taking the time to speak to us.
Good evening, Tapiso, and thank you very much for having invited me onto your program.
So just this that I mentioned, the fact that South Africa is ready for a phase 2 of a COVID-19 vaccine candidate trial. Is this satisfactory for you? Do you feel like we're making progress?
Oh, definitely. I really think South Africa is to be commended for the very engagement in vaccine trials. So, because we have already had one start, this is the second one. It's very commendable. I do think that, and we as WHO, we're encouraging more African countries to come on board and be involved in these vaccine trials. We have Mali in the pipeline, Guinea-Bissau as well. Other countries have been considering how to get involved in vaccine trials. It is absolutely important that these tools be tested in African populations as well, and this gives us more rights to have access as well.
And I want to talk about that, the vaccine trial in the African context. I know at some point we were saying only 5 African countries had signed up for this to be part of the vaccine candidate trials. Have more jumped onto, the flying boat, so to speak?
I mean, there are some countries that are in the pipeline waiting, including for some of the solidarity, so-called solidarity, WHO, if you like, coordinated trials, making the links between various partners. In some cases, this is moving a bit slowly. Partly it's to do with the regulatory clearance by various regulatory bodies wanting to see, so what is the protocol, how should this be conducted. It's our hope that this process will speed up and in the end, more African countries will be engaged. And
while we're still on that, on Novavax, I see just some of the technology that it's going to be leveraging off is it's being developed in terms of successfully against influenza virus and experimental vaccines against Ebola. Do you think under these circumstances it could help other countries such as the DRC that's battling another outbreak of Ebola?
Oh, yes. I think, the more vaccines of similar types are developed, the more there could be possibilities for more vaccines. I mean, certainly a couple of very effective Ebola vaccines are available, and these are already being used in the field. They were used very effectively in the North Kivu, in the eastern part of the DRC outbreak, and they are now being used in the Equator region of the DRC. So as far as that is concerned, that tool is available. In Ebola, it's more a matter of making sure that we get very quick acceptance by people to be vaccinated and then having the supplies of the vaccine to roll out.
I suppose, in a way, I was referring to the twin challenges of both. And we're operating in an environment that we don't know what the properties fully of COVID-19 are, how they affect people, under what circumstances. And then you have that added pressure of a hemorrhagic fever.
You know, I think we are learning more and more, and the Ebola experience has been really important in this too. At the same time as we are taking a vaccine through trial, be using it under emergency provisions in order to have an impact on an actual outbreak and a situation. This was very well carried out with the Ebola vaccines, and here what the world is confronting is the need to very quickly discover vaccines that are effective as well as safe, and then to roll them out at a quite unprecedented speed all over the world. So we are learning more and more how to go through these emergency processes, whereas, as you know, in the past, to develop a vaccine would take years, and then to roll it out would also take some years. So the context now is extremely different.
Let me bring you back to South Africa, where the WHO, of which you're leading part of the search team in South Africa. South Africa is moving to alert level 2 tomorrow. Many people are excited. The president has said we're obviously seeing less cases, but the South African Medical Association is warning of a second wave or a second curve. Are you concerned?
You know, what we are acknowledging is the fact that in all countries, there is a need to balance what is done in terms of these very drastic social and physical distancing measures, and what is done to enable economic activities, people to be able to earn their livelihoods to continue. What is most important is that indeed one almost expects that once people can move around a little bit more, there will be an increase in cases. We expect and we hope that the public health capacities have been developed in the country, in some of the worst affected areas and in other areas as well, so that they will be capable of quickly any flare-ups of disease. And most importantly, that people now have understood the role that they can play, and that people are enabled to play their role. Wear your mask all the time correctly, covering your nose and mouth, social distance as far as possible, sanitize and make sure that you practice those hygiene practices. So it'll be a matter of combining the role of people, the public health capacities, and targeting carefully where the flare-ups are seen before and hope to avert a huge second wave. Certainly, I think we should expect some cases to occur. There might be a further increase, but the capacities that have been built up, and this is the objective of our being here as WHO, not only advising and working through our country team, but bringing in additional capacity to deploy to the provinces and some of the worst affected districts to help to contain what may happen as these measures are eased. We expect some of this.
So you are prepared for that. Just in terms of schools reopening, I want to talk about that. In a couple of weeks' time, we're going to see more grades go back to schools as the country reopens. And I know the study, the joint venture that you had with UNICEF showed that before COVID-19, there were, I think, 2 in 5 schools actually lacked the hand-washing facilities prior to the onset of the coronavirus pandemic. But that picture hasn't much changed here, despite concerted efforts by government. Does that concern you?
I mean, again, we, like other partners, like partners in UNICEF and people in the education sector, would of course like to see children go back to school, because we know the negative impacts of children being out of school for so long. But this needs to be done safely. So yes, the gap in access to water, hand-washing facilities is a concern. And it just means that there is work that needs to be done as schools are being opened up to make sure that these facilities are availed, even on a temporary basis. We have partners, including UNICEF, who work in the sector of water and sanitation, who can ramp up their efforts make sure that either water and soap or sanitizers are made available. And of course, we also need to make sure that there is spacing, the children are wearing masks, and that the opening does not in itself then constitute opportunities for super spreading of the virus. All of this always needs to be managed based on data and based on scaling up the capacities for prevention. This is what we're emphasizing very strongly.
And very quickly, Dr. Moeti, your trajectory, or rather your predictions of the trajectory for Africa as a continent, I mentioned we've already surpassed the 1.1 million mark. Are you hopeful that we're able to contain this, that we won't have any major flare-ups in other countries that are also reopening?
Yes, we're very hopeful of that because we've observed, if you look at the graph for the African region, the weight of South Africa in terms of an exponential curve has been very heavy. At some points, over 66% of the cases, new cases, were occurring here. And for the rest of the continent, we've had a rather more gentle, flatter curve. Countries are easing up now. We are seeing in some of those countries an increase in cases, but already we're starting to see a gradual reduction, and we hope very much to continue to have, we have to deal with the viruses here, an increase in cases, but hopefully not something exponential and totally out of control.
Thank you so much for your time. World Health Organization's Africa Regional Director, Dr. Matshidiso Moeti.